In this video, I'm going to show you 5 easy standing exercises to relieve sciatica leg pain fast. Now, some people may even feel a difference in as little as 30 seconds. Keep watching. Hi, I'm Dr. Tam, chiropractor here in San Jose, California. And over the past 20 years, I've treated hundreds of patients with severe sciatica, herniated discs, and chronic neck and back pain using non-surgical, science-based solutions. Now, sciatica often involves irritation or pressure along the sciatic nerve. Tight hips, low back muscles, and increased nerve tension can drive pain from the lower back into the legs. And most videos tell you to lie on the floor. But during a leg pain flare-up, getting down and back up can make symptoms worse. Now, for some people, sitting or lying down increases the leg pain. That's why I've designed this exercise routine to be done standing. Now, you can use them at work, at school, anytime you need for quick leg pain relief. And these are simple, effective movements you can use when your leg pain symptoms start to develop. Before you get started, let me share a couple of quick tips. Go through the exercises in the order I give them. I put them in the sequence on purpose because they build on each other and tend to work better together than if you skip around. Also, stay within your comfort level. I mean, these stretches should feel controlled and manageable, not aggressive. Let your body guide you and only progress when you feel it's right. Let's start with exercise number 1, the standing wall cobra. Now, this is a gentle standing back extension done facing a wall or a doorway. Now, with your pelvis supported and your upper body lifting into extension. Now, we start here because extension often helps reduce pressure on the irritated nerve caused by a herniated disc in your lower back. You may notice your pain begin to move out of the leg and back towards the lower back. This is called centralization, and it is a sign that the sciatic leg pain is improving. So what you're gonna do is you're gonna get up onto a wall. Hips are gonna get stabilized against the wall, so you're gonna press your hips up against the wall like this. Go ahead and put your hands and rest it up around your hips like that. And the move is similar to an extension. So what we're gonna do is we're gonna press the hips into the wall and then we're gonna extend back. Now, if this is good and you feel a release, fantastic, hold that there, 15 to 30 seconds, okay? But if you need a little bit more, obviously step back a little bit, press your hips into the wall, and then extend back, and you can go a little bit more, okay? And hold that there, 15 to 30 seconds, and then bring it back in like that. So with this, you can do 2 to 3 repetitions, and again, holding for about 15 to 30 seconds on each, and you're gonna feel a release of that sciatic leg pain in your back and down your leg. And if you're getting that centralization, fantastic, keep doing it. Obviously, if it hurts, stop. Let's not do that one and move on to the next. And you can try it again later because maybe that flare-up is stopping you from being able to do that move in that moment. The next move is the step back piriformis stretch. Now, this stretch targets the deep hip muscles, especially the piriformis, which sits close to the sciatic nerve. Now, when this area is tight, it can increase pressure and contribute to pain down the leg. Now, this stretch, again, is a standing stretch that you can do for the piriformis muscle. That's that deep glute muscle here. That sciatic nerve actually runs underneath that piriformis muscle. And when it's tight, it can put pressure on that nerve, giving you that sciatic-like symptom. Now, in combination with the disc herniation, that can make it really bad. So the way that you stretch this is, what you're gonna do is a staggered stance like this, and I'm gonna show you on the other side as well. Staggered stance. Now, let's say, for example, the sciatic pain is on this right side. So the right side, you're gonna have the foot back, the left foot forward, and you're gonna internally rotate the hip, okay? So that's really important. Internally rotate the hip here, and then this front left leg, you're gonna internally rotate it like that. So you're gonna have a stance like this. Now right here, you're gonna almost always feel kind of like a deep stretch already in this position. And it's really important to keep the weight onto the heels, okay? Keep your weight onto the heels. Don't let your feet flare out. Weight onto the heels. Now in this position, Hold that. If that gives you relief, good. Hold that there for a little bit. But then we're gonna actively move into this stretch. So the movement is gonna be like this. You're gonna have your hands on your hips, and I want you to slowly turn. Remember, the heel needs to be into the floor. Don't let your foot flare out. Hold this position here, and you're gonna slowly turn into this side. Now what you're gonna feel is a stretch all the way in here on this right side. And oh yeah, that feels good. I can feel that. That's a really good stretch. Hold that for 15 to 30 seconds and then come on back, okay? Again, here we go. We're gonna plant our heels into the ground, internally rotate the back foot, the forefoot here, heels into the ground and turn, keeping the heels flat into the ground, 15 to 30 seconds. Hold that there. You're gonna feel a deep stretch into the piriformis. Now, I always say do both sides. Even though you may not feel the other side, stretching should always be bilateral, okay? So that's the step back piriformis stretch. This is what it looks like on this side. So we're gonna use this leg here, staggered step, okay? Internally rotate that hip, internally rotate this hip, hands on the side, okay? Heels planted, and again, turn into the side where the back leg is. And hold that there. 15 to 30 seconds. Hopefully that gives you relief. You can do it 2 times a day, about 7 days, and then you can decrease that as you start to get better. The third move is the Quadratus lumborum stretch. Now this stretch targets the Quadratus lumborum, a deep side low back muscle that can tighten and pull unevenly on the spine and pelvis. Now when this muscle is tight, it can increase tension around the lower back and contribute to sciatic symptoms. Now this stretch is for a muscle in the deep back erector muscles right through here, and they're on both sides, okay? And it starts from here and it fans all the way up through the lower back and it attaches into that area. Now this muscle is a big muscle. It's a big culprit for lower back pain, and a lot of the times it can get so tight that it can actually give you some of that sciatic-like symptom because of that guarding effect that it's having on the disc. Now this is a fantastic stretch. I do this every day just to kind of get that muscle to loosen up, all right? But it's very important to follow these steps. Now, what you're gonna do is go through a doorway so that you can hold on to it, okay? What we're gonna do is we're gonna plant. So if we're stretching the left side, you're gonna plant the left foot, and the foot needs to be planted on the ground. It can't shift back and forth. It needs to be stuck on the ground. Think of it as if you've got glue on your foot and it's not moving, okay? The leg needs to be straight, right? As the leg is straight, you're gonna hold this position here. You're gonna cross the other foot over top and point your toe onto the ground. Now this is more for balance. It's not doing any stretching. So this is just for balance. So you're gonna point your toe right here just for balance. Now remember, this leg is straight, planted into the ground. You're not gonna bend at all. Keep it straight. This one over, pointed toes for balance. Now, what we're gonna do is we're going to then reach with this arm across onto the wall or the doorway, okay? So again, planted, balance, we're gonna reach for the doorway, and what you're gonna do is then you're gonna let the hip drop. And as the hip drops, you're gonna feel a stretch all the way through here, all the way through your Quadratus lumborum. Now you notice this is just for balance. The stretch is actually through here. And that's why you don't want to have your foot go up, because it will take the tractioning force off of that muscle, okay? So again, here we go. Plant, over top, point the toes, balance, reach across, stretch it down, let that hip drop all the way down through here and feel that stretch come through here. Now at this point, you can actually play with the rotation. Maybe you like to do this, you feel more of a stretch here, or maybe it's more like that, but you just gotta play around with that rotation and you're gonna feel a nice deep stretch in through here, and that was amazing. Do the opposite side, same thing, plant here, cross, and you're gonna reach across and then let the hip drop. It's letting the hip drop this way, okay? That's how you do the Quadratus lumborum stretch. The fourth move is the standing sciatic nerve floss. This movement gently mobilizes the sciatic nerve itself. Instead of stretching it aggressively, you can guide it through these 3 controlled progressions that gradually increase tension and release. The goal is to improve how the nerve moves through the surrounding tissue. When done correctly, this can reduce sensitivity along the nerve and often provides noticeable relief while you are doing it. Exercise number 4. This is the standing nerve floss. Now, in some of my other videos, we talked about how to do this on your back, okay, and seated. But this video, we're gonna talk about how to do it standing. So this is how you do it. So you're gonna go ahead and grab, now you can use books, you can use a stool, you know, anything such as something like this that's off of the ground, okay? And what you're gonna do is you're going to take the affected leg, so if it's the left side for me, I'm gonna go ahead and place my heel onto that. Now, in this position here, if you feel comfortable and there's a little bit of release, perfect. Maybe that's all you need to do. But if you want to step it, and I'm going to show you a couple different variations going from least to most feeling of the stretch, okay? So we're going to put this here and just hold that there. And again, 15, 30 seconds, see how that feels. Now, the next step that you're going to do is you're going to do some ankle pumps, right? So you're going to pump the ankle down and up. And this is a nice gliding motion. You're going to feel, as you're doing this, some heating happening within the leg, a little bit of release, hopefully a decrease in that sciatic pain, and just do this about 15 to 20 times. All right, and this is again on the affected side. Obviously, if you have the other side is affected too, you're gonna switch it up and do the other side. Okay, so 15 to 20 times, just pumping the ankle nice and controlled, so you're not pumping it back and forth. It's a nice smooth controlled arc. So that's the second one. Now, the third variation is now we're gonna add some head movement with this, okay? So if you're pointing your toe down, you're gonna look down. And then when you bring your toes up, you're gonna look up. So you're following that motion, down, up, okay? And again, 15 to 20 times doing that movement. And again, flip it to the other leg if you need to. Now, the next step, if you want to make it a little bit more challenging, then what you're going to do is you're going to have the foot up in this direction, and you're going to bend forward just slightly, and then we're just going to move the arms back and forth in this motion, just like that, okay? And again, 15 to 20 times doing this, come back up, and then do it again, 15 to 20 times doing that, okay? And then the next thing that we're going to do, this is the last one for this type of exercise, is when you're doing this toe up and down movement. Before, remember, all we did was we moved the head up and down. This time what we're going to do is we're going to actually bend our body. So we're going to come down and we're going to bend and then come back up and then bend, come back up and then bend and come back up. Okay, so the bending action actually gives us a little bit more of that movement. And then again, here, actually, I'm going to give you one more. You're just going to have your toe up like this, and you're just going to bend at the waist, just like that. And you're going to feel a deep stretch in this area as well. Okay, so again, a lot of different variations with this standing nerve floss. Do the one that helps you. You don't have to do all of these. You're going to find the one that actually gives you that release in your sciatic nerve. Do that exercise. Again, if it hurts, guys, just don't do it. Maybe your body's not ready for it yet. You can come back, circle back later, try it again. And if not, then just move on to a different exercise. The fifth move is the doorway backdrop. Now, this is a supported standing extension using a door frame to gently open the chest and extend through the mid and lower back. We finish with this movement to reinforce extension and help maintain the relief you just created. Now, it encourages the spine to stay in a more open position, which may reduce recurring pressure on the irritated nerve and help you stay more comfortable after you finish the sequence. The last stretch that I'm gonna show you is called the doorway backdrop. All right, and this is a really great stretch as well. It's almost like a decompression stretch where you're gonna feel a little decompressive force in your lower back, opening up that space and allowing those muscles to just breathe, okay? This is a fantastic stretch, you're gonna love it. So what you're gonna do is, and I'm gonna show you over here, but what you're gonna do is take your arms, you're gonna cross it over like this and then grab a doorway, okay? So remember, it's like this, all right? So You're gonna step away from a doorway, something that you can hold on to, all right? And then you're gonna go ahead and grab onto the doorway here. And then you're gonna go ahead and just bend your knees a little bit and let your back fall to the ground as you're supporting here. So you're not pulling up, you're just letting your body weight and gravity pull you back. Now in that position, you're gonna feel a nice deep stretch here in your erector spinae muscles. And that's also gonna help to take some of that pressure off of that sciatic nerve, because it is decompressing that spine slightly as well, okay? So let's show you again. So you're gonna step over here, okay? You can have it higher. Now, if you have shoulder pain, maybe go a little bit lower, right? But, you know, I'm gonna go up in this position because this feels good for me. And then I'm just gonna go ahead and let the arms extend and then drop backwards like that. And oh yeah, that's a great stretch. That feels fantastic. And again, hold that 15, 30 seconds, and then come on back up like that. Okay? You can do this as often as you can throughout the day. There's no number. It's just based on how you feel and when you feel that you need to do this stretch. There you have it. 5 standing exercises that may help relieve sciatic leg pain and reduce pressure on the nerves. Always remember to do what feels comfortable for you and progress only when you feel safe and ready. Only go to your comfort level. Stop if pain worsens, numbness increases, dizziness occurs, or symptoms radiate further down your leg. If you found value in this video, like it and share it with someone who needs standing sciatic relief. And tell me which stretch gave you the most relief. Was it the Quadratus lumborum stretch or the step back Piriformis stretch? Drop a comment and let me know. Subscribe if you want more tips on how to protect your spine, understand your condition, and learn the treatments that help people work towards long-term relief. And if your sciatica is related to an L4-5, L5-S1 disc bulge, and you want to see how we can treat that without surgery, watch the next video where I break down our non-surgical treatment protocol step by step.